I'm going to deal with a very interesting topic, something contrary to what most of my colleagues have spoken of. That is, can a fellowship untrained ophthalmologist be a successful refractive surgeon? Just give me a minute. Okay, so this is really a pertinent and practical question to us today. Because uh, although most guys are fellowship trained, there are a lot of fellowship untrained ophthalmologists who just venture into refractive surgery. And some of them are successful, some of them are not. It's a very complex question because there are many layers to this. This can only be this question can only hold for refractive surgery. You can't have it for something like oculoplasty or some other specialty where you actually need to be trained. But because refractive surgery has such less not so much surgical skill required, a lot of people venture into it without having a formal training. What is needed to make a good ophthalmic specialist? Not refractive, just a general good ophthalmic specialist. You need to have a good subject knowledge, you need to have good clinical skill, and you need to have good surgical skill. These three are needed to make a good specialist, and obviously you obtain this from your fellowship training. But how does a good ophthalmic specialist become into a successful ophthalmic specialist? I think my colleagues have stressed enough on this. If you own your practice, you have to be able to market yourself to your patients. If you are a freelancer, you have to be able to market yourself to doctors. And if you have a fixed job at a tertiary center, you need to have all these traits of being hardworking, passionate, having an academic interest, a teaching interest. But how is refractive surgery different from other specialties? Okay, for one, refractive surgery is never given importance as a standalone field. It's always with cataract or cornea or something else. It's an ironical branch because it's a purely surgical branch. You don't have like a medical management in refractive. It's purely surgical, but at the same time, it is not very surgically demanding, and it is very heavily industry driven and investment based. So this is how it differs from other branches. So generally, you don't get a fixed job at a tertiary center if you are into refractive surgery. So you have to basically be able to market yourself to your patients well. And the biggest question mark is whether fellowship training is needed or not. So yes, people can argue that there's not much surgical skill to master, but there are a lot of aspects of refractive surgery that do need training. They need formal training. So the surgical training part is needed, even though it may be less. You do need to train yourself in microkeratomes and doing smile, in handling intacts, and there are so many surgical procedures that come under refractive. Counseling and dealing with unsatisfied patients is something that you don't learn overnight. You can't just start off by doing LASIK and not knowing what to do when they come to you. You need training. You need to have seen these patients in and out. The surgical planning part is one of the most important aspects of refractive surgery. So you need to plan well for a good outcome. And we are dealing here with patients who are very anxious and tolerate zero margin for error. So you cannot afford even a minus 0.25 or minus 0.5 error. So you're dealing with such patients. So these are the aspects that do need training. But unfortunately, there are a lot of limitations that current refractive surgery fellowships offer us. So for one, the institutes that offer pure refractive surgery fellowships are far and few in between. So I can't think of too many, at least in India, which offer pure refractive surgery fellowships. And the ones that do offer, very few of them actually give you surgical work. So they'll give you everything, planning and all. But then, if you want to learn how to do a smile, not many centers may teach you how to do that. A very important question that has to be asked is, does a fellowship teach everything? Okay, so you can't, do a fellowship, not learn how to do a microkeratome and then come back into practice wanting to, again, learn microkeratome. You've spent 1 year in a fellowship and, you still need to learn a microkeratome is something that, according to me, is not acceptable. A fellowship should teach you everything in refractive surgery, and I don't think many fellowships teach you everything. And another important factor about fellowships is that after you come into private practice, you realize that you can't replicate everything that you have learned into your private practice. So, you suddenly feel paralyzed or handicapped that, okay, I had this tool for me to screen this patient, but now I don't have it. What should I do? So these are the limitations that current refractive surgery fellowships offer. according to me, it may not be as beneficial as it seems doing a refractive fellowship. So if you don't do a fellowship, then how do you train yourself in refractive surgery? One very important way is learning from the industry. Okay, so your industry engineers, the people who supply your excimer laser machines, they are very good teachers. They know everything, right from the anatomy of the cornea to how it will respond to how the machine does things, and they keep workshops so you can learn from the industry. If you're a good cataract or anterior segment surgeon, you can become a good refractive surgeon, as Dr. Palak has already spoken about. Because if you're a good cataract surgeon, you can start practice with, phakic IOLs. So if you have a godfather, mentor, teacher, these are the sort of people who can help you. If you have a practice, like in my case, my father is a practicing refractive surgeon. He has taught me a lot of the small, finer aspects of refractive surgery. So this also definitely helps. Even if you don't have a godfather or mentor, you can just go and observe established surgeons. And trust me, in refractive surgery, observing established surgeons in your area, how they deal with patients, does make a big difference. You can learn a lot. And you should not miss the opportunity for a good conference or a workshop or even a CME. There are these small CMEs which come and go, from which you can learn so much. You can interact with people from other places, how they go about their work. And these are all the ways, according to me, how you can learn refractive surgery in spite of not doing a formal fellowship. So then why should you do a refractive surgery fellowship? Well, if you want to publish and make a name for yourself in refractive surgery, I think doing a fellowship is the only way you can do that. If you have an eye on the center, no center is going to hire you as a consultant. So if you do a fellowship at the center, you become an asset to the institute. The institute doesn't want to lose you. You can use that as an opportunity to actually work at the center and make a name for yourself as a refractive surgeon at that center. And also, if you are interested in learning everything about refractive surgery, even if it means not able to replicate that into your practice. So yeah, there are people who want to learn everything and then decide whether they want to implement that in their practice. So these are the reasons why you do a refractive surgery. But when you do it, you should know exactly what to expect. As I have said, do a proper research and then go in for a refractive fellowship. What you shouldn't do is you shouldn't start a refractive practice thinking that there is no skill involved. Okay, so that is absolutely a no-no. There are a lot of people, retina, glaucoma, oculoplasty guys who say, okay, I'm bored of what I'm doing. I'm going to buy an excimer laser and start refractive surgery. And it's not going to work. Or, you have to be very lucky to make that work, because it's really difficult to deal with patients, to deal with complications afterwards. You need some sort of training before you start. Don't do a refractive surgery fellowship just for the heck of it or for an extra degree. If you're truly interested only in phacoemulsification or cataract, do a phaco fellowship. Don't do phaco refractive, because you are disrespecting refractive surgery. There's a lot to be learned and you won't be doing justice to that part of the fellowship. And don't just take a fellowship because you want to work at the institute without having an interest in the brand. So many people just want to work, say, in LV Prasad or some other big institute, and they just take the field without having an interest in that. So give it the due it deserves, because refractive surgery, you have to respect the field whether you are trained or not. And trust me, there is a lot to learn. There is LASIK, customized treatment, keratoconus, phakic lenses, presbyopia. There is a lot to learn. It's not like just as what some people think, very limited. There's a lot of scope. So my final thoughts, my answer is yes, a fellowship untrained ophthalmologist can be a refractive surgeon, provided you follow the points that I have said. And if you don't have a fellowship, you can always do FICO if you feel that you are skilled enough for that. If you need an additional certification, the All India Ophthalmic Society gives you this opportunity. And yes, so that is what I have to say. So thank you.